Well, Shelley, the CDC specifically made a major revision on how we contact trace people who may have been with someone who tests positive. Joining me now, our guest health expert, Dr. Payal Patel Davladabadi, Associate Professor of Public Health at the University of Evansville. Dr. Payal, very good to see you. This was a sudden decision by the CDC, but Director Dr. Robert Redfield pulled back. The CDC first said people without symptoms did not need to be tested if they were exposed to someone with the virus. Now it says close contacts may consider getting tested. How do you react to that?
It can be very confusing as well. We are still trying to get more and more people tested so we know they are diagnosed and they can isolate. So initially, the recommendations were close contacts should get tested at around day 5 to see if they are infected or not. And now with the new recommendations, given that, they don't need to be tested or they may need to be tested, it's very contradictory. We know that up to 50% of COVID cases can be asymptomatic, meaning that they do not exhibit symptoms. And with the new guideline, it specifically states, if you do not experience symptoms and you are in close contact, you do not need to get tested. That would mean that we would be probably foregoing 40 to 50% of cases who are asymptomatic, not tested, and they are not in quarantine either and potentially infecting other people. So if state health departments and local health departments go by this, which many are not, we could see another increase in the number of COVID cases.
Let's talk about convalescent plasma now, Dr. Payal. How it could be used to fight the virus. What do you think about that?
Yeah, so the FDA, we currently have investigational convalescent plasma. This is basically where those who are positive with COVID and have recovered and have had a recovery period of at least 2 weeks, so they have enough antibodies developed in their body, they donate plasma, and then that is actually injected to treat severely ill COVID patients. This is more of a natural treatment, and it's worked in the past with other diseases such as MERS and SARS and polio and rabies and a number of others. And so it is investigational, but research has shown that it is effective in treating the more severely ill patients. So many physicians and doctors around the country are working on this, doing research on this, and this could be something very promising.
Rapid testing, how reliable are those tests, Dr. Payal?
Thus far, there are a number of tests out there, but thus far, these tests seem to be about 85 to 90%, have an 85 to 90% accuracy. Of course, swab tests and those tests done with the polymer chain reaction are the most accurate COVID tests. They provide the highest sensitivity and the lowest number of false negatives. But just as with any test, you will see some false negatives.
Schools, of course, are now ramping up in-class learning. The EVSC says so far it's been a smooth transition. What are your thoughts about virtual versus in-class learning as we stand right now?
Right. Well, we're continuing to see significantly high numbers on a daily basis of new cases. I do understand the importance of in-person learning for students, as being in that learning environment with peers. And I know schools have worked very hard to implement preventive measures, very strict preventive measures. So my advice is that schools are working very hard. We need to abide by these guidelines and really emphasize that parental and guardian responsibility. If your child is sick or exhibits symptoms, don't send them to school. If they are diagnosed, keep them in that isolation or quarantine period for that specified amount of time. That's going to be very essential.
We've got less than a minute, Dr. Payal. Higher education now. Nationwide, some students are just not following campus policies. Just today, the president of Ball State University said he may just go to virtual learning for the rest of the semester if students don't start behaving themselves. He's saying this is because of what they're doing off campus and not on campus. What do you think?
Right. We have a very controlled environment on campus. Campus policies are in place, so students have to abide by those, and it's very true. We do not know what students are doing off campus, and that is how the spread is going to happen on campus, is what they're doing off campus, bringing it to on-campus activities. And so I always emphasize at UE that personal responsibility. Whatever you're doing on campus, those personal habits, those preventive measures need to be carried out off campus and just to make those effective decisions. That's the only way we can have on-campus learning is if students are responsible.
All right, Dr. Payal Patel Davladabadi, thank you very much for joining us today.